My name is Landon Jones, and I am the medical director for the Pediatric Emergency Department, which is the UK McKenna David Pediatric Emergency Center. When I was in the middle of my residency, I just fell in love with the pediatric emergency medicine side of it, and loved going to work. I love treating the patients on the pediatric side, so it was a simple decision for me. Working in the emergency department, we see absolutely everything. The presentation of like a fever to up through trauma, for seizures, for broken bones. We see anything and everything that walks through the door, and that's what we love. Your experience, though, starts totally differently. When you walk through the door, you actually walk into the pediatric emergency department, and in the pediatric emergency department, it's a more kid-friendly thing. There are some video games, there's an interactive wall that is downstairs that the kids can interact, and butterflies will land on their shoulder, or bubbles will roll off their shoulder. We have pediatric dedicated specific nursing staff, okay, so that are familiar with children and know and love kids. We've got physicians that have pediatric specific training. We have respiratory therapists that are involved. We have special in terms of like imaging. So we do have a lower radiation like CT scanner or a CAT scanner is what a lot of people will call it sometimes. We are a teaching hospital, and the residents are very actively involved down in the pediatric emergency department. And the residents will see the patients. I will see the patients as well as the attending physician. I think the biggest thing, especially with kids, is talk to them. The parents are obviously always there and they're always listening in, but I think if you talk to them and make them feel like they're a part of it as well, I think it really helps with the whole process. Pain and fear is a big thing about coming to the pediatric emergency department, so we actually have medications that we don't actually have to put an IV in for to actually give. We have ones that if we need to help with pain, we've got medications that can go up their nose to help with pain, so it's a really quick onset of the medications, and we can take care of their pain a lot faster than putting in an IV. And if they're very anxious, we've got other medications that can do oftentimes like a combination of pain and the anxiousness as well. But those are some of the really cool things that we actually have here. For whatever reason, I just always wanted to be a doctor, and I went through the time where I was like, well, maybe I don't want to be a doctor, maybe I want to do something else. And after exploring the other things, it just seemed I always wanted to come back to it. The coolest part of my job is I never have 2 days that are ever the same. Okay, from my perspective, that's the coolest thing. But really, what even more, I guess, really more cool than that is the fact that I get to see things change quickly, and I get to see a child come in that is having difficulty breathing, and I get to see that really turn around very quickly. Just seeing the kid that doesn't want to move around, doesn't want to do anything, and then an hour later they're like literally running up and down the hallways of the the pediatric emergency department. That's the greatest thing that I see.